Hello, Harry Brownlow, shoulder specialist. Today I'm going to talk about how we might choose to treat a dislocation of the acromioclavicular joint, or AC joint. That's the one up here, where the collarbone meets the shoulder blade. It's quite a common injury. It usually occurs when you land very heavily on the tip of your shoulder, so not without a chance to break your fall by putting your arm out. So it happens when you fall very suddenly, so quickly you haven't had a chance to break your fall. This usually happens when your feet go out from under you on ice, for example, or playing rugby and someone takes your feet out from you unexpectedly, or you're on your bike and you're clipped in and you just haven't got time to come off the handlebars and break your fall. And it's a really painful injury. It seems to be more painful than breaking your collarbone. And you will know something has happened, and almost inevitably you would have taken yourself off to casualty to go and get an x-ray. Now, if your shoulder AC joint is dislocated, there are broadly two ways of treating it. One way is to manage you without an operation, and the other is to manage you with an operation. And I'll describe the pros and cons of both. So if we talk for the first one, that is managing you without an operation, this is by and large the recommended treatment in the western half of the hemisphere, that is Europe and Australasia. And we recommend this because we recognise that 90% of people who are treated without an operation get back to full function and normal use of their arm after about 3 months from their injury. So by avoiding an operation, there's every likelihood that you will return to having a completely normally functioning shoulder, even though your AC joint will remain permanently dislocated. When I did my fellowship in Sydney, we treated a lot of professional rugby players, and almost all of them had dislocated AC joints, and they all returned to playing professional rugby without the choice of surgery. So you can return to doing everything and anything in the vast majority of cases. While you're waiting for things to settle down, it is painful and you will need to wear a sling, certainly for the first few weeks while it's really sore. But the type of sling that you wear has no bearing on the likelihood of whether you might be in the success or the failure group, or how quickly you return to activities and sport and work and driving. So the sling is simply about pain relief and has no bearing on trying to get the shoulder to reduce itself, because it cannot and will not. So most people will choose not to have an operation, but there are 10% of people who wait the full 3 months and are still not happy with the outcome. And what they complain of varies very much from person to person. Some people, it's still just a matter of it being painful. For others, it's an odd sense that in some way the arm is no longer properly connected to their body. For others, they feel they've lost confidence in using the shoulder, and for others too, it's a lack of strength. And if you fall into any of those groups at 3 months, then there is an operation that can be considered. And in my hands, it's the same operation that I would use if we were to choose to do an operation right from the start. So that's what I'm going to discuss now. So the alternative way to manage your AC joint dislocation is to have an operation. The operation is done under general anaesthetic, that's with you asleep, and I would usually book you a bed overnight because, and I don't understand really why this is the case, it's a really painful operation, and you'll want to be somewhere where we can give you good strong pain relief for the first few hours. The operation is done with a cut over the top of the shoulder, and I use a synthetic ligament to reconstruct the torn ligaments that we loop around a bit of your shoulder blade and then up over the collarbone, and we drag it down as tight as we can and we hold it in place with a screw. You then have to be in a sling for 2 weeks after the operation. After that time, we allow you to come out of the sling and start to move it. And at 6 weeks, you can start to take some more weight through the arm and do more physical things. But it isn't until 3 months after surgery, and this depends as long as the x-ray is good, that you can return to full collision and combat activities. Now, As an operation, like all operations, it does carry risks and complications, and these are something to talk to your surgeon about before you make the final decision. So as you can see, there's no absolutely right or wrong answer, and most people, once they've had a chance to listen to some kind of discussion like this, come to a fairly clear and quick decision in their own mind, which is the right way for them. Thank you.